A very good evening, guys. I'm back today with my favorite topic, sepsis, and very important in the critical care unit. We'll be learning today what is sepsis, what causes sepsis, what is the treatment, and what can be done to prevent the sepsis. So let's start with my favorite topic, sepsis. So what is sepsis? Sepsis is response of the body to an infection. What happens is the microorganisms invade the body tissues, and in turn patients exhibit an immune response. So the immune response, it provokes the activation of biochemicals and mediators associated with inflammatory response. So what happens is it increases the vasodilation, which interrupt the body's ability to provide adequate perfusion and oxygen and nutrients to the tissues and cells. So what happens is sepsis is a response to an infection, right? When microorganisms, they enter our body, they invade into the body tissues, and the body in response generates an immune response. The immune response, it provokes what the biochemical cytokines, and which is called an inflammatory response. That causes is it increases the vasodilation. So what happens is the body is not perfusing well, the organs are not perfusing well, they're not getting enough oxygen and nutrition because of the sepsis, because of the microorganisms invading into our body. So this is an inflammatory response. Inflammatory response, it activates the coagulation system that forms clots whether or not there is a bleeding in the body. So the imbalance of the inflammatory response and the clotting are the critical elements that helps us diagnosing the sepsis in the patients. So the sign and symptoms of sepsis is the ability of the body to provide oxygen and nutrition decreases. So what does the heart do? The heart starts compensating by pumping the blood faster, right? So you will see vasodilation due to hypertension. You will see the patients breathing faster because they want to eliminate more CO2 from their body. You will see decrease in the urinary output because the body wants to conserve the water to prevent dehydration due to the infectious process. You will see change in the mental status. You will see on the arterial blood gases, the patient's body becomes acidotic. You will see the rise in lactate levels. So the physicians and the doctors would be ordering the serum lactate to be drawn on the patients too frequently to assess what kind of or what level of sepsis the patient is at, right? Testing, how the patient is tested for sepsis, you will be collecting the complete blood count because we want to know what is the white count on the CBC. You will collect blood cultures, 2 sets, one aerobic and one anaerobic. Make sure you're collecting the blood cultures before administering the antibiotics to the patient. You will do the BMP. You will assess for the LFTs and the kidney function. That's very important to monitor when the patient is diagnosed with sepsis. Lactate level, again, as I told before, that the doctors and the PAs would be ordering the lactate level to be drawn per policy or whatever their judgment says. So, but the lactate level will be drawn too frequently. There would be urinalysis ordered, and if the patient has a wound culture would be ordered to assess for the sepsis. So next comes the treatment, how the sepsis is treated. It's treated with antibiotics, broad spectrum antibiotics. So it's very important to start the antibiotics within an hour of the symptoms started, but you also have to make sure that you have collected the blood cultures before starting the antibiotics on the patients. You would usually see the patients would be started on Zosyn, Rosefin, vancomycin, ciprofloxacin, and maxipine. Make sure that you're squeezing the bags correctly. medication is mixed correctly so that the patient gets its correct dose. It's very, very important that we have to monitor for the efficacy and for any adverse reactions of the antibiotics. Fluid challenge. Initially, the first when the patient is diagnosed with it, unless contraindicated, we would be challenging the patient with the IV fluids. We would be giving 30 ml per kg per hour the fluid that would be ordered by the PAs. They would be ordering crystalloids like lactate ringers that would be given to the patient initially. Because the body is hypoperfused, we want the body to perfuse, so the fluid challenge would be given. It would help with the perfusion and also with eliminating the lactate from the body. If the patient persistently stays hypotensive, that means the blood pressure remains low, we would be starting them on the vasopressors to maintain the mean arterial pressure greater than 65. Most of the times you would see that they would be started on levofed. If the dose is being too high, we would add another pressor called vasopressin or neosynephrine. It depends on the physician what kind of vasopressors do they want. So it's very important to know what is sepsis again. It is a response to the infection by the body. And what is septic shock? It is sepsis plus hypoperfusion and hypotension. Two different categories. Very, very important to assess for the sign and symptoms. The initial sign and symptom you would see in a patient would be tachycardia, fever, low blood pressure, hypotension, which is known as hypertension, change in the mental status. Patient will have change in the mental status. You will see decreased urine output. So these are the basic sign and symptoms you would assess in a patient when the patient is on the pathway to sepsis. And as soon as you see that the patient, is the sepsis protocol is being followed, make sure you run to get your fluid bags, to get your blood culture bottles. Make sure you're monitoring their O2 sats. You have to make sure that their vital signs are stable. So for that, run for your O2 sat monitoring, run for your fluids to maintain the blood pressure, call the lab, ask them to collect all the required labs as soon as possible so you can start your antibiotics. Keep notifying the providers if the blood pressure still remains low, because the patient might need to be transferred to ICU for the pressors. As a nurse, you have to make sure that you are preventing the sepsis. Very, very important to practice the infection control. Make sure you're practicing the hand hygiene. You're cleaning your equipment. You're preventing the central line infections. Make sure your central line dressings are changed as per the policy. You are changing the caps every time you are, doing something that is hindering the sepsis protocol or sepsis prevention. Make sure you're using the alcohol swabs, the chlorhexidine swabs as per the policies, 30 seconds to 60 seconds before administering any medications through the central line. Very, very important that the patient gets their chlorhexidine bath if they're in the ICU, because once a day, because the patients they need to stay as clean as possible. Make sure you're assessing for the wounds. It's very, very important to notify the providers if you see any open cut or any open wound, because that could be one of the sources of initiating the sepsis in the patient. Make sure your equipments are clean. Make sure your tubings are changed per the protocol. Make sure the room is very neat and tidy. The patient is neat and clean. It's very important to turn and position them every 2 hours to make sure that they are not dirty. We're preventing the sepsis through one of these ways. Drawing the labs on the time. administering the antibiotics on time. Um, so these are the major initiatives that you could take as nurses to prevent the sepsis in ICU. Um, and it's very, very important that we educate the patients once they're getting discharged how to prevent the sepsis, because it's not one of like those easy topics. It's like very critical. A lot of patients annually die because of the sepsis if they're not treated appropriately, and it's one of the most challenging situations in ICU for most of the doctors, PAs, and the nurses to deal with. So make sure that we're following the protocol, we're making sure that we're doing our best to treat the patient with sepsis. Thank you very much.